Hi, my name's Morgan Atkinson. I'm an exercise physiologist, and today I'm going to be talking about exercise for people with multiple myeloma. Okay, so one of the questions that I often get is why would a cancer patient want to exercise during or after cancer therapy? Now, as we all know, cancer patients often endure long and difficult treatment processes that often affect the person's physical and psychological well-being. Some of the commonly reported side effects that we see as exercise physiologists include excessive weight gain or weight loss, pain and discomfort, loss of muscular strength, endurance and flexibility, reduced functional capacity or the ability to carry out daily tasks, sleep disturbances, depression and anxiety, cancer-related fatigue and lymphedema. The American College for Sports Medicine convened a roundtable of experts to put together a position stand on exercise for cancer patients. And essentially what they were asked to do is to summarise all the evidence and come up with some guidelines for exercise professionals to assist them with exercise prescription. What they concluded from that paper was that cancer patients can expect exercise-induced improvements in aerobic fitness, muscular strength, flexibility, symptoms including pain, functional capacity, sleep, energy and vitality, bone health, depression and anxiety, fatigue, quality of life and lymphedema. So just a brief summary of the literature with regards to exercise for people with myeloma. So what we know is there are a small percentage of myeloma patients that meet the physical activity guidelines, and those guidelines are 150 minutes of physical activity each week. And those people that do meet the physical activity guidelines have an increased quality of life. Some of the barriers to exercise include symptoms of the myeloma itself, side effects from the cancer therapy, and symptoms including pain, fatigue, fear of infection, and low self-esteem. Some of the perceived benefits of exercise include improved recovery from the symptoms of multiple myeloma and the side effects of cancer therapy, psychological benefits, and also social benefits and enjoyment. And what we know about exercise programs for myeloma patients with the limited research that we have is that it seems to be safe and feasible, and it also improves upper and lower limb strength and also quality of life. With regards to exercise guidelines for people with cancer and specifically myeloma, it's recommended that patients exercise at least 3 to 5 times per week, and ideally we're engaging in physical activity on each day of the week. So it doesn't necessarily mean that we need to engage in gym-based activity. We basically just need to get our heart rate and our breathing rate up to the point where we're finding it a little bit difficult to talk. In terms of intensity, we're trying to achieve a moderate intensity, which basically means we're trying to get to the point where we're finding it a little bit difficult to talk when we're exercising, and our heart rate and our breathing rate is up. Some of the activities that might do this include a brisk walk or a medium pace cycle. In terms of the types of exercise, we should try and do exercises that involve large muscle groups. That doesn't necessarily mean we just have to do walking and cycling. Activities such as swimming can be appropriate and can be good for relief of pain. However, it needs to be appropriate in terms of the stage of treatment and whether or not you're immunocompromised. So it's important to talk to your exercise professional or haematologist if you're going to engage in swimming-based activities. So in terms of high impact activities, it's probably best to avoid high impact activities. So these activities might be activities such as contact sports, jumping, hopping, skipping, because there could be a risk of fracture. In terms of using public facilities, again, it's important that we understand that it may increase your risk of infection. In terms of the duration of exercise, we want to try and achieve 20 to 30 minutes of continuous exercise on 3 to 5 times per week, preferably up to 7. However, if you're deconditioned and you can't achieve 30 minutes or 20 minutes of continuous exercise, it's appropriate to complete short bouts of exercise for 3 to 5 minutes with intervals of rest in between those 3 to 5 minute bouts. It can also be broken up throughout the day, so you might want to participate in 5 minutes of activity in the morning, 5 minutes at lunch, 5 minutes at night. So that's an acceptable way to get the 20 to 30 minutes of activity in. With regards to progression should be slower and more gradual for deconditioned patients or those who are experiencing severe side effects from the treatment. Patients should meet frequency and duration goals before they increase their intensity. It's important that we try and progress the program as tolerated. Now, with regards to people going through cancer therapy, sometimes progression is maintenance. So in a sense, if we're not losing functional capacity, that's considered to be progression. So when prescribing exercise for people with myeloma, it's important to consider the risks. So with myeloma patients, often they have issues with multi-organ complications as a result of the treatment or their disease. Bone pain is often an issue, with approximately 70% of patients presenting with some type of bone pain and or lytic lesions in some of the long bones and or spine that could induce a fracture when going through an exercise program. At least 60% of patients with myeloma are anemic at diagnosis, and nearly all become anemic during treatment. Therefore, fatigue concerns can be a distressing symptom and compromise your ability to exercise. Sleep-wake disturbances are commonly reported in myeloma patients and may contribute to the development of mood disorders and depressive symptoms. Further, increased daytime sleep and fatigue may decrease daytime physical activity, which may lead to physiological deconditioning and diminished activity tolerance. So deconditioning is often the loss of muscle mass, loss of muscular endurance, and a feeling of fatigue and lethargy that persists throughout the day. Further considerations for exercise include treatment-related issues such as immune function and infection risk, anemia, leukopenia and thrombocytopenia, so basically low blood cell count, so low red blood cells, low white blood cells and low platelets. Neuropathy, which is loss of sensation in the periphery, so it tends to be in the feet and the hands. Nausea and vomiting can be an issue when people are going through cancer therapy, and also reduced appetite. If we have a reduced appetite, that can also increase our feelings of fatigue and weakness too. With regards to comorbidities, we must consider any underlying pre-existing health concern, such as heart disease, diabetes, lung disease, or pre-existing injuries or issues with mobility, as this can influence our ability to exercise. Medications can also have an impact, and they need to be considered when we're going through an exercise program too. With regards to low red blood cell counts, it's important that high intensity exercise is avoided, as often people will become fatigued really quickly and they won't be able to maintain their intensity for any period of time. If people are immunocompromised, we need to avoid activities that might increase the risk of infection, such as swimming, crowded gyms, saunas and or group activities. With regards to low platelet counts, we need to avoid activities that may increase the risk of a bleed or a bruise. So high impact activities, contact sports, heavy weightlifting may be contraindicated. With regards to fatigue, fatigue can be an issue with a large percentage of cancer patients, specifically myeloma patients. And participation in moderate exercise can actually help to reduce feelings of fatigue, and that can be done regularly throughout the day. With regards to nausea, diarrhea, dehydration, it's often a good idea to perhaps not engage in an exercise program when you've got those symptoms. If you insist on engaging in activity, make sure that you've got adequate fluid on board and you don't participate in vigorous activities or activities that require balance. With regards to dizziness, limit the amount of exercise, and if undertaken, make sure that it's supervised, and avoid exercises that require balance and coordination. If you're trying to select an allied health professional to assist with an exercise program, it's important that you look for the following things. I feel that it's important that your doctor is aware and provides clearance before engaging in an exercise program. Once you have medical clearance, it's important that some form of assessment is undertaken. Now, the person should try and get information about your past and present medical history, so they have an understanding as to what's happening with your current medical health and your past medical health, because there can be concerns with regards to exercise prescription. Once a detailed patient history has been obtained, it's important to complete a functional assessment. Now, the functional assessment is designed to assess how you're functioning. We often use a functional assessment called the Fullerton's Functional Assessment for older adults. Now, this assessment is used to gain really simple information about how you're functioning. So we complete tasks like a 6-minute walk, a timed up and go, 30-second bicep curls, 30-second chair stands, and maximum self-selected gait speeds. So some form of functional assessment is important. There might also be a need to assess your pain and your musculoskeletal system if you've got issues with lytic lesions in your bones. Often people have concerns about fracturing a bone when engaging in an exercise program. So what is a fracture risk? Now, fracture risk is determined by a multidisciplinary team, including medical input. And often we're considered a fracture risk if there are large lytic lesions of the long bones or extensive lytic disease in the pelvis. Also, if you've got spinal instability, it would be considered a fracture risk. So how do we find an appropriate allied health professional to prescribe an exercise program for us? The best way to get access to an allied health professional is to see your GP and get an enhanced primary care plan or team care plan arrangement. This allows for up to 5 free sessions with an exercise physiologist or physiotherapist. Further, private healthcare rebates for exercise physiologists and/or physiotherapists are available through most private healthcare providers. So to access an exercise physiologist close to your locality, you can click on the Exercise and Sports Science Australia website and you should be able to find an exercise physiologist close to you. Further, if you wish to access physiotherapy intervention, you can click on the physiotherapy website and you can find a physiotherapist that might meet your needs close to your locality. Just a note to finish. This is a quote from the Surgeon General of the United States of America. When individuals with chronic conditions such as cancer are unable to meet the stated recommendations and their exercise recommendations, so 150 minutes of moderate to vigorous activity on 5 to 7 days of the week, on the basis of their health status, they should be as physically active as their abilities and conditions allow. An explicit recommendation was made to avoid inactivity, and it was clearly stated that some physical activity is better than none at all. So I feel that it's important to engage in physical activity throughout the treatment course. And I think if you're going to engage in an exercise program, it's important to seek out the appropriate advice and the appropriately trained allied health professional. So go and talk to your haematologist, talk about exercise and about wanting to engage in an exercise program, get medical clearance, and then seek out the appropriately trained person to assist you with an exercise program. If that person doesn't give you the information that you need and that you require, seek out other people that can help you. Further, if you engage in an exercise program, you're likely to improve the way that you function, you're likely to reduce feelings of fatigue and weakness, and you're likely to feel better both physically and mentally.
I was diagnosed with myeloma in April 2012 and I had been working full-time for 35 years and hadn't done much exercise at all. And once I was under treatment and I was still sitting around and people were mollycoddling me, and I knew that I had to get moving. And it was when I was preparing for the stem cell transplant and I was referred to the cancer care group to exercise at the CPA gym at Hampstead, and that's really when I started exercising. Part of feeling safe in exercising with myeloma, a big part of that is that I have an individualised program. When I come to the gym at the CPAA, everything I do there has been carefully selected to be appropriate for me by an exercise physiologist who's able to access my medical records and to be able to very carefully determine what's safe and effective for me to do in that supervised environment. And also there's guidance about what I should do outside of that.
Fatigue is quite a significant factor in the whole myeloma journey, and it's very easy to give into it and just sit back and sleep. And if you can push yourself past it and get into exercise, one, it takes your mind off it, and two, I think mentally you get on and do things. So a bit of exercise is the catalyst for me to keep moving or get going again.
When I'm feeling fatigued, my first inclination is not to exercise, but my experience has been that if I do undertake even some mild exercise, I feel better. If I'm starting to feel a bit low or feel a bit dark about life, I know that if I do some exercise, even if it is just a walk around the block, that my mind will come to a more positive outlook.